FDK and TPC have a memorandum of understanding whereby TPC commits its support, expertise and assistance with building and infrastructure.
We have an agreement in place for TPC to provide electricity to the pilot farm, which is huge. Electricity is not available in most parts of Mtakuja. Your pumps on your boreholes are only going to run as long as there is power.
Agriculture is really the breakthrough for improving their living standard.
Adam Puza heads the training of Mtakuja farmers.
So we are expecting that after 2 or 3 seasons there will be a lot of changes to the community in terms of the income. They'll have more income, and that will bring them access to education, health care, and also most of them will now be constructing modern houses and the like.
The project has come far, but it is only in the first stage. A savings and credit program has been introduced by the US-based community development organization Floresta. Early 2009, villagers in Mtakuja came together and formed a village community bank known as Vikoba. Villagers are used to counting in livestock, cows, chickens. So while they have had to accustom themselves to saving bills, the Vikoba system has also adapted. Edith Banzi is the Floresta Country Program Director. According to Edith, women especially can benefit from the program.
When you look at women, because those are the most members in the groups, and they are most vulnerable people as well, because most of them in our setups are not educated. So they depend on their husbands or the farming activities within their household. And you find it very difficult for women to get some savings, some enough money to save in banks or other microfinances. So with Vikoba, most of the women have been able to accumulate a certain amount of money.
Unlike the majority of Mtakuja's inhabitants, the Maasai are pastoralists and depend most solely on grazing cattle. Due to drought and overgrazing, many Maasai are in a transitioning period to other forms of livelihood. Once averse to education, they recently requested a pre-primary school for their children, which will be built soon by FD Kilimanjaro. Several Maasai are also part of the communal pilot farm project.
Sasa kama sasa hiyo mradi inayokuja kuna mambo nyingi tu, maana sasa kuna lima tu mashamba, natoka hii mahindi na mboga yoyote ile. Lakini pia mimi hamuna shamba kule.
Income generation will improve living conditions, health, and access to the medical services. Dr. Harry Marinde, Chief Medical Officer at the TPC Hospital, on the lack of medical services in Mtakuja.
Accessibility to hospital sometimes is a big problem. You'd find mothers delivering on the way because there are no regular public transport. And once poverty is out, we expect disease to be out as well.
FD Kilimanjaro recently engaged in a partnership with Dutch NGO Medical Checks for Children, MCC, which came to Mtakuja for a week to examine all children 0 to 9 years old. Local health providers were fully involved in the medical camp, and children in need were referred to TPC for follow-up. MCC will likely come every year for the next 5 years.
Uzuri kupata tiba ya vidonge
To be able to examine 1,193 children, as the 9 MCC doctors did, is invigorating and inspiring. Nevertheless, expresses Dr. Carleen Bongers, the conclusions are sobering ones.
When you go to Africa, you are impressed by the bad health of children. I mean, there's a lot of underweight, feeding problems, anemia, worm problems, HIV. Sometimes it makes you cry, because it's so easy to improve, and it doesn't cost that much. It's just education and water supplies. If children can wash themselves and mothers can wash their hands with soap before making dinner, the health will be improved amazingly.
Proof of the integrated approach is evidenced in the findings of the medical camp. Only a daily lunch can greatly contribute to a child's health.
What we can see here in the school, we checked for school children and normal population, and we can see that the school children who got better food, they are in a better health than the other children. We see in the whole population it's like 40% as anemia, and in school children it's only 20%. This is just the food program.
FDK only plans to operate in Mtakuja for a total of 5 years. During that time, the project will go through several phases and finally become sustainable by the community. More boreholes will be dug, crops will be provided for the school lunch program, and the surplus will be marketed to enhance income generation and cover the operating costs of the boreholes. The men and women of Vikoba will have workable businesses. With a higher income, more parents can send their kids to school, and some students will receive scholarships for further education. Yearly medical checks as well as hygiene education will improve the health of children, and over time, the village as a whole. But it will take time for all these elements to come together.
You come in here and you have grand plans. They might not be so clear in the beginning, but you know the broad strokes and you want to get started. And things take time. Everything just moves slowly. And I realize I have a hard time acknowledging that and even relishing the fact that it takes time, because there's probably some benefits for things to move slowly. I think this part of Africa, and it might be similar elsewhere, they've seen a lot of NGOs come and go. They've received a lot of support in different ways. But there might also at the same time be, a real level of disillusionment. Here comes another group of people who say they're going to do something, and then they assess it, and then they never come back. But I mentioned the fact that to us, the funders, what's critically important is the integrated approach. We strongly believe that it's all linked, and everything kind of needs to take off together. And of course you try to prioritize, and certain things take longer than others. But the community is, I would say, solely focused on the income generation component of the project. So even though I've been here 14, 15 months now, they still ask me on a daily basis, when is the project starting? And I laughed and I said, no, the project has started. Look at what we're doing in the schools. Look at the medical camp that happened a few weeks ago or last week. The Vikoba groups that a lot of people are members of. Next week we're announcing a scholarship program for children to go to secondary education. We have drilled boreholes, we have built a road. Lots of things have happened. But ultimately, even though we've taken some good steps, with especially the boreholes being drilled and the medical camp, which are very tangible for people, they will only really believe it when those first seeds go into the ground.
Finally, according to Stella, the project will only be sustainable if Mtakuja inhabitants are mobilized to participate.
After the projects have started, people must be educated on how to take care of the project well.